I want to next look with you at a few arguments and issues further that are involved in this debate, just to be sure that we've touched on these things. These were all mentioned in the chapter, but just want to make sure that these things, you connected with them. Well, one of the issues that does get discussed is, well, how does compassion enter into this, especially compassion for people who are in pain and who are suffering, and isn't there a duty to help people who are suffering to relieve their pain? And I think most, if not all of us, would say, yes, there is a duty to help people who are in pain, people who are suffering. And on top of that duty, we know that we have the emotion of compassion as well, so we do care. The problem is that the pro-euthanasia camp uses this to say that, well, some people, they're terminally ill, they're in excruciating pain, we know that they can't be cured, at least not by medicine. And the question here is, wouldn't the compassionate thing be to end their pain by giving them a lethal injection of some mixture of drugs to put them out of their misery? Wouldn't, or foregoing the use of technology if it's not already in place, or removing it? There's a lot of people who think that to maintain life, even apart from questions about whether this is a person or not, whether the individual, the patient, has made his or her wishes known or hasn't, there's just the fact that some people are in great pain, and in spite of advances in pain medication that for many people can keep them out of pain, there are still some types of diseases that just don't respond very well to pain medication. And so it seems like the only way to relieve the pain is to relieve them of their existence, if we can put it that way. And so some have said that if there are laws that keep you from doing this, those are really cruel laws. On the other side of the debate, people who are against euthanasia are not lacking compassion. We do care about pain and suffering that people are experiencing, but the argument would be that not every means of relieving pain and suffering is necessarily morally acceptable. The person who's in pain and suffering has done nothing which is deserving of losing their life. And so for me to say, I want to get rid of this suffering and pain, and the only way I can do that is to end their life, but I would be doing it for a good purpose, I'd stop the suffering, well, that's consequentialism, right? I have a certain goal that I want, and if the only means to attain that goal is to put them to death, then so be it. But that's not the way a non-consequentialist makes ethical decisions. We look for principles, and yes, there is a principle that we are to show compassion to people. We're to help people get out of pain and suffering insofar as we can, but there's also a principle that says we're not to take innocent life. And that doesn't mean these two principles conflict. But the principle that says we're not to take innocent life modifies the options of what I can do to express compassion in relieving pain and suffering of someone who is terminally ill or even not terminally ill. So we don't want to deny the importance of this, but only to say not every means of removing pain and suffering are going to be morally acceptable if you have some sort of deontological theory or non-consequentialist. Well, then there's the whole discussion of the distinction between killing and letting die. And as I've listed here on the screen, there is the Jones-Smith example. And basically, all of this stems from an argument that the ethicist James Rachels, R-A-C-H-E-L-S, has put forth. And the intent of his argument is that that he wants to prove that there is no moral difference between killing and letting die. And so if one of those is morally acceptable, the other is. Now, killing, that's active euthanasia. Letting die, that's passive euthanasia. So what Rachel's is really up to is to show you that actually if one of those two, active or passive, is morally acceptable, then the other is as well. And of course, Rachel's thinks that letting die or passive euthanasia is morally acceptable. Now, the way he goes about making this argument is to imagine for us two individuals who are rather wealthy, and they have uncles who are quite greedy. One of these fellows is Jones, the other one is Smith. And Jones and Smith both decide that they're going to kill their nephew so that they can inherit their money. And what they both decide to do is that at the time when their nephew takes a bath, they're going to drown him. So, and I never seem to remember whether it's Jones or Smith, but it doesn't matter. Let's say it's Jones. In Jones' case, he waits until his nephew goes in and takes a bath. He's in the bathtub, and Jones comes in and he drowns his nephew. He holds him under the water until he drowns. Now, Smith has the same thing planned for his nephew, but as it turns out, Smith's nephew is a bit clumsy, and so as he goes into the bathroom, he gets ready for the bath, he stumbles, falls forward, hits his head on the bathtub, and falls face first into the bath water unconscious. And Smith comes along and sees that his nephew is in this condition, knows that he will drown, and rather than doing anything, Smith stands there and does nothing, and his nephew dies. Now, what Jones did is an example of killing or active euthanasia. What Smith did is an example of letting die or passive euthanasia. And Rachel's says that not because of the outcome necessarily being the same, not necessarily because of the outcome being the same, let me say that more accurately, but because the intent of Jones and Smith was to do evil to their nephew, and because the action or the omission of acting in both cases resulted in their evil intent being fulfilled, we would say, in evaluating the morality of the two cases, that Jones was just as guilty of murder as Smith was, and Smith just as guilty of murder as Jones was. And Rachel says, as a result of this, you should see that there is really no moral difference whatsoever between killing someone, that is active euthanasia, doing the Jack Kevorkian type thing, the suicide machine, or letting someone die, withdrawing medical technology or failing to apply it in the first place. And of course, then what that's going to mean, if there's no moral difference between killing and letting die, that means if one of them is morally acceptable, then the other one is going to be morally acceptable as well. And Rachel's, of course, thinks that passive euthanasia is, in fact, morally acceptable in certain instances. Well, what do we say about that? If you've read the chapter, you know that I have a rather extended discussion of that. But what do you think? Just those of you who haven't had a chance to read this, do you think it is true that all cases of killing are morally equivalent to all cases of letting die? I mean, that's the basic argument. The more fundamental question is that even if you think killing is morally equivalent to letting die, do you think either of those things is morally acceptable? Because the basic underlying assumption that Rachel's has is that passive euthanasia, letting die, is morally acceptable, and if letting die is morally equivalent to killing, then both passive and active euthanasia must be acceptable.
Question.
Yes?
How can, but isn't one decision God's decision? Well, why should we make that decision as to whether it's morally or not morally acceptable? How about letting God make the decision?
Okay, the question is, in terms of this argument, why do we think we have a right to decide on the morality of this? Why don't we let God decide on whether this is moral or immoral? Well, I think initially we'd have to say that in the examples that Rachel gives of Jones and Smith, Jones and Smith are agents, and they either do something to take a life or they do nothing to ensure that a life is taken. And so we're wanting to ask whether what they did or what they failed to do is moral or immoral. So God's not the one that drowned Jones or let Smith drown. So the question then would be, what we want to know here is not whether God kills or lets people die. We want to know whether we have a right to kill or let people die. And if, in fact, God has addressed this issue, it's not clear in Scripture that he's addressed it in exactly this form. And even if he has addressed the issue of taking innocent life, which we know he has, what Rachel's is arguing is that killing is morally equivalent to letting die, and God hasn't addressed that per se in Scripture. So there's a reason to ask the question. Now, God would surely disagree with Rachel's that passive euthanasia is okay in certain circumstances. So his thought that passive is equal, whatever's true of passive is true of active, well, God would not buy that, but then we shouldn't either, but we need to explain what's wrong with it. Hence, that's why the discussion. Okay, other thoughts on this? Yeah.
I got a strange question, because I'm trying to put that together by fast forwarding a little bit to the concept of capital punishment, because your question was, is that killing moral or not? So, like, kind of going forward to the discussion of capital punishment, saying, okay, in certain instances, yes, now rewinding back, in certain instances like this, in the Jones-Smith, the intent's wrong, so no. And then tying it back to the whole concept of euthanasia, if you kind of see where I'm kind of...
Okay, let me see if I can restate the question. We're wondering, how does this conversation that we're having about Rachel's argument impact what we would say about capital punishment? And, you know, how do you fit these things together, whatever you say about either of them, consistently? And I would say in response, the critical issue is that the taking of life in capital punishment is not the taking of innocent life. That is, the executing of the criminal is not, who has committed murder, is not a taking of innocent life. But there's no crime that someone has committed by having a stroke or a heart attack or getting old or having, you know, some sort of disease. So the two issues are separate. What you would say about capital punishment does not have an awful lot to say about this. Though it is interesting that folk who typically favor euthanasia are against capital punishment. And people who are against euthanasia oftentimes are in favor of capital punishment. Now, there's a section in one of the chapters, it may be at the end of capital punishment, where I raise that issue and say, how can this be consistent, and then explain how it is. But what I've argued in the book about the Jones-Smith example is a number of different things. First of all, is it true that all instances of killing are morally equivalent to instances of letting die? And I mean an end-of-life scenario. We're not talking on the war field, on the battlefield, or what you do in your neighborhood. Is it true that all instances are like the Jones-Smith case? Okay, a number of you are shaking your head no. That's good. We'll come back and ask why. Is killing ever morally equivalent to letting die? In other words, is Rachel's totally off base when he says this? I mean, or are there cases where active and passive would be morally equivalent? Yeah, I think there are cases. Yeah, I'm sorry.
I think it's a challenging example because you're trying to take an evil intent and transpose it into a good intent. So it's hard to make that transition when you're looking at, for me,
Well,
to see these two guys that have an evil intent,
Yeah.
and then try to translate that into somebody who's like making a decision about something they care about.
Well, yes and no. The comment is hard. It's hard to apply this argument because we're talking about two people in this argument with malicious, evil intent, and that doesn't necessarily apply to people who don't have that evil intent. But regardless of what we might say about that, I think the key thing is we've got to understand why Rachel's even constructs these examples. What's he trying to prove? And the point that he's trying to prove most fundamentally is that there's no moral difference between killing and letting die. Now, he happens to think that since letting die is morally acceptable, killing would be as well in other cases. We could disagree with him about that point, but we still might agree that instances of killing are equivalent to instances of letting die. And at this point, in his defense of active euthanasia, his strategy is to show that active and passive are morally equivalent, so if one of them is acceptable, the other one is too. Now, we might in general agree with that, to say if one is acceptable, the other, well, not necessarily. Even if killing and letting die are morally equivalent, that doesn't mean either of them is acceptable. And if one of them, if they are tied together as morally equivalent, if one of them is wrong, then the other one is wrong too. And I have argued that the basic assumption that underlies this whole argument is flawed. Namely, the assumption is that letting die, passive euthanasia, is morally acceptable. And so Rachel sets out to show you that killing is equivalent to letting die. So since we've already decided, or Rachel's has, that letting die is okay, then that means that killing must be okay. So don't worry about, if you're not worried about withholding treatment from someone who's terminally ill, you shouldn't be worried about sending that person to physicians to get the drug cocktail that can then be given to him that takes his life actively. So the most fundamental question is, are all cases of killing equivalent to all cases of letting die? Some of you who are shaking your head no. Why not? I think you're right.
Doesn't it come down to whether you're free to do something?
That is a major, major issue. Would you like to?
Well, a train driver, somebody runs onto the tracks and he's not actually free to do anything apart from kill that person, but we know the law wouldn't hold him responsible. And when we were looking at what makes a decision moral, one of the things is whether we're free. And when we talk about passive killing, it's actually not passive killing because we're making a choice, effectively.
Okay. The answer that's being given is, I think, correct. And what's being said is that it is not the case that every instance of killing is equivalent to every instance of letting die, because sometimes, whether it's an instance of killing or of letting die, you're not free to do otherwise. The train driver who rams into a car that tried to cross when it shouldn't have, cross the road, surely kills the other person. He takes an action which kills him, though he surely didn't intend to, and at the speed the train was going and at the timing that the car crossed, there seemed like no way to avoid this. So you wouldn't say that what he did is even morally equivalent to someone prescribing and administering, not under pressure, but of their own free will, a dose of lethal drugs. So not even all cases of killing are morally equivalent to all cases of killing, let alone are they always equivalent morally to all cases of letting die. Well, yeah, I think you're right. And I think a key what I've argued is, first of all, this discussion, I think, is a bit confused, and I mean Rachel's discussion, because he hasn't separated out, and people who have interacted in it have not distinguished two questions which need to be kept distinct. And given what we did with ethical theory, you will realize immediately when I say this that these are distinct questions. We have to distinguish, first of all, between the morality of the act and, secondly, the morality of the agent. And we can make evaluations in both cases. If we're looking at the morality of the act that Jones did and the act that Smith did, I think we have to say they're morally equivalent. And that's true whether you're a consequentialist or a non-consequentialist. As a non-consequentialist, I look at the principle, it's not right to take innocent life. And whether it's taken in the way Jones did or taken in the way Smith did, I think the act is equally immoral. What about the morality of the agent? Well, in both the Jones and the Smith case, the agent was free to do or to fail to do whatever they did. The intention was the same. It was evil. And we know that moral duty says that taking innocent life is morally wrong. And as a result of that, we know that they didn't act morally because they didn't do a morally good act to do. So, and we would say that of both Jones and Smith. So indeed, there are cases where the act and the agent are morally equivalent, whether it's a case of killing or whether it's a case of letting die. But those aren't the only examples. I mentioned some other examples, and suppose we're comparing a case where someone has had a heart attack or a stroke, and from all the tests that have been done, they can tell that the person is so severely brain damaged that if they survive, and it's not clear that they will, they're not going to be able to interact with anyone. They're probably going to remain unconscious for as long as they're alive. And as the case goes on, that becomes clear that it's true, and in the midst of that, the person starts to have trouble with their breathing. So the question is posed to the family member, would you like to put the person on a respirator or not? And a decision has to be made. And let's say you're dealing with a pro-life doctor, and a very competent one, and he says, you know, your family member may die in a few days no matter what we do, and surely this isn't going to cure him. You know, you have to decide whether you even want to start this, or whether you just want to use no technology, let nature take its course. Second scenario, someone is terminally ill, they're suffering greatly, and they come to you, you're a physician in the state of Oregon or Washington, and they ask you for aid in dying. Would you give them a lethal injection or a prescription for a cocktail, so to speak, of lethal drugs administered to you? Well, it seems to me that the former scenario would be an instance of letting die, and the latter would be an instance of killing. So passive versus active. Are the two morally equivalent? Well, I think that they are not morally equivalent. In the first case, using respirators or other medical technology is not going to guarantee that the person lives, let alone even gets better. So it may be futile. There's a good chance that it is. So the act of withholding is not, in this case, necessarily immoral. Because if you had introduced the technology, it's not clear that it would have made any difference. And for someone to think, in cases in general, that you're morally obligated to use respirators, well, I don't think we should be ready to make that kind of generalization. We should say, well, there may be cases where a respirator would be useful and the person is likely to recover, and in that case, maybe you could make a case that you're morally obligated to introduce the respirator, but it would be hard to make that kind of case for moral obligation to use a respirator in every instance. So in the imagined example, there's not, the act of withholding the technology does not seem to be immoral, but when it comes to the lethal injection, that's something that definitely will take the person's life, and the person is innocent of no crime that warrants having his life taken. So I think we could say that that act is an immoral act. As to the agent, well, in the first case, he's not free to save his friend's life by introducing technology, withholding it, or anything else. So if you're not free and you don't use the respirator, regardless of your intentions and desires to save his life, you're not going to be morally accountable for having done something immoral if you couldn't save his life anyway. When it comes to the lethal injection, no one's forcing the doctor to do that. He is free to not give this, and he's free to give the injection. And his intent is to do something which, as a matter of fact, breaks a moral rule, and no one's forcing him to do it. Yes, the patient has asked for it, but asking for it is not the same thing as demanding it or forcing the doctor to do it. So there's a case where killing and letting die are not morally equivalent. So now what does that prove? Well, it shows that there are some instances of active and passive which are morally equivalent, and there are some issues of some instances of active and passive euthanasia that are not morally equivalent. And the result of that is that you should be cautious of using this argument. You should not be persuaded that it justifies both active and passive euthanasia, because not all instances of killing are morally equivalent to all instances of letting die. But then the other point to make is the most fundamental point, that Rachel's makes this whole argument with a presupposition and assumption that he brings to it, and that is that if the two are equivalent, then they're both morally good, because of course letting die is morally acceptable. That is a false assumption. I can agree that cases like Jones and Smith are morally equivalent, but that doesn't mean they're both morally acceptable. And Rachel's himself does not present those examples as though he approves of them. He disapproves. So similarly, even if an instance of killing is morally equivalent to an instance of letting die, that doesn't mean they're both moral. That can mean that they're both immoral. And in cases where killing and letting die are not morally equivalent, the examples I gave just a few minutes ago, we'd say the killing is morally wrong because the doctor didn't have to do this, wasn't forced to. The letting die is not morally wrong because the person involved was not free to save the life of the friend by using technology. So by withholding technology, he didn't kill his friend. Yes?
I wanted just for a quick moment to go back to the sensitive issue of having a mother pregnant with a child with cancer. I wonder what you would think about if killing and letting die are the same in that situation, because I'm having a little trouble seeing how if for the mother, she's not, if the case is she's not free to save herself without actively killing the baby, without actively killing another human being, then I'm having trouble to see whether that would be permissible. Like in another situation, if I was terminally ill and the only solution that I had involved the taking of another person's life,
Okay, let me see if I can summarize the question. The question is how can and does it apply to the abortion type scenario we were talking about yesterday, where the mother has cancer, say uterine cancer, and is pregnant, and if she forgoes treatment on herself, that in effect will end her life, but it will preserve the life of the baby. If she starts treatment on herself, that hopefully will preserve her life, but it will certainly take the life of the baby via abortion. I guess I would say in response to that, I'm not sure that example is equivalent to the kind of thing that Rachel's is after, because what he's after is having clear instances of distinct acts, one of which is killing and the other is letting die. And usually they're not, you can't accomplish both of them with one act. You're talking about two separate instances. And the mother's only going to do one act or one omission of an act. It will have more than one effect. Actually, the example that you have given might be more relevant to the discussion of double effect. We're going to get to that in just a little bit more. But I think the basic thing that we have to do with the Jones-Smith thing is to understand that it's an imaginary example and it is made to illustrate a very narrow point. Namely, that this author wants to prove that there's no difference between killing and letting die, which means no difference morally between passive and active euthanasia. So if one is right, the other's right. If one is wrong, the other's wrong. And by the way, Rachel thinks that letting die is okay. And I think in the case of the pregnant woman and the baby, we would have to say, depending on her intent, well, I shouldn't go back there, just because the Smith-Jones examples are distinct examples. What Smith does to his nephew does not have causal efficacy on what happens to Jones, and vice versa. But what the woman does in regard to herself does have causal connection with what happens to the baby, and vice versa. What she doesn't do has causal connection. So they are different types of example. I can see that there is some sort of a connection, but I think that really what you're asking is going to be addressed a bit more when we talk about the principle of double effect, though not entirely. So, I mean, we talked a good bit about that other scenario yesterday. Okay, good question. Yes?
In the case with the respirator, even though there is the certainty of death, is there still an obligation, at least from a biblical standpoint, to try to preserve life as long as possible? And so does moral responsibility fall in if you fail to do that?
Good question. And actually you're anticipating the latter part of our discussion on euthanasia. But the question is, in the case of the respirator example that I gave, even though the person is going to die, if using the respirator would prolong their life somewhat, is there a moral obligation to use the respirator? My inclination would be to say yes, but, and the but is I'd want to know the medical circumstances. Are we talking about prolonging life for maybe the afternoon? Or are we talking about prolonging it for months? If this person could live for months on a respirator, then I think probably there is the duty to use the respirator. If they're going to die within the afternoon, whether you use a respirator or not, I think a case could be made that there's no need, morally speaking, to use the respirator. Now, others would say, well, maybe not morally, but from a practical standpoint, if the person's going to die within a few hours, if using, regardless of what you do, but if using the respirator would make him a little bit more comfortable the last few hours, well, why not? I mean, as we said yesterday, this idea that the use of technology is going to make it impossible to die is, I think, an assumption and a fear that a lot of people have, but it's a flawed assumption. And if it's flawed, then the thought that, oh, well, if I put my relative on a respirator, he can't die, that's an unwarranted fear, and it shouldn't enter into our moral reasoning, I don't think. Okay? Yes, one more, and then we want to talk about a few other.
I just wanted to get clarification then. If you're factoring in on the respirator example, with the doctor's wisdom, whether they get 3 hours or 3 months, is that consequentialist then? Because you're
No, not necessarily. I know what the principle is. I'm not supposed to take innocent life. What I want to know is, are there exceptions to that? And if the medical situation is such that I know this person could continue to live for 3 months or maybe longer, if we use the respirator, and who's to say that they couldn't recover, if that's a possibility. But even if it's not, I think still it's not in my province to take innocent life at that point. But if the doctor says, I'm certain, and it's a pro-life doctor, and he points to a variety of things that he's not, your relative, your friend is not going to live out the night. So you can put him on the respirator, but it is not going to prolong his life any more than if you don't put it on. Well, then it seems to me that if I fail to use it, I'm not breaking the command that says don't take innocent life. See, the point is, by failing to use the respirator, am I taking innocent life? In some cases, I would be, and so I should use it. In other cases, like the one I mentioned, I would not be taking his life by failing to use the respirator, because he's going to die in a short amount of time. So if I say, well, then don't use it, I haven't broken the command. But then I might still say to the doctor, okay, he's going to die within a few hours. Either way, in your judgment, would he be more comfortable on the respirator during these last 3 hours as opposed to not? Because I do also sense a duty to relieve pain and suffering as I can. And if the doctor says, well, I think he could probably be a bit more comfortable, I'm not sure that that means I'd say, well, then I'm morally obligated to put the respirator, but I'd probably get pretty close to saying that. If the doctor says, I don't think it's going to make much difference in how comfortable or otherwise or not he is, then probably it isn't going to matter in any way, morally speaking. Okay, good questions. Well, double effect arguments. First of all, what is the principle of double effect? What is it about? And then we can talk about how this principle gets used in some discussions about euthanasia. Anyone who has an idea here? What is it that has a double effect? Are we talking about people? Are we talking about actions? Are we talking about just what? Okay, well, let me help you out. We're talking about action, but we're talking about only one action. We're not talking about two actions. We are talking about one act that has two results. One of the results is desired and desirable. The other one is undesirable and undesired. Now, an example of something like this would be someone is terminally ill, they're in great pain, and normal medications, pain medications, will not help them. So you decide to do something a bit stronger, or the doctor suggests that you do so. Give him morphine. The morphine will surely work to relieve the pain, but it will also hasten death. It'll get him addicted, etc., etc. So one act, the granting of this pain medication, has two effects. It, on the one hand, relieves pain, but it, on the other hand, hastens death. And you'd like to have the pain relieved. You're not trying to bump him off, kill him quickly. But that's a situation of double effect. It's one act that has two results. One of the results you want and the other one you don't want. Now, a double effect line of argument takes this kind of scenario and asks, would it then be morally permissible to perform this act that's going to have these two separate effects? One desirable, the other undesirable. And people who use double effect arguments argue that as long as you intend the positive effect and not the negative effect, and as long as the only way to get the positive effect involves getting the negative effect, then it's morally acceptable. In other words, if you can relieve this person's pain without turning him into an addict, without hastening his death, well, then you should give a kind of pain medication that does that. But in a real case where the only kind of medication that will work is one that will hasten death, though it will also relieve pain, then the argument goes, that is the argument that people who use this make, as long as your intention is to produce the desired effect and not the undesired, then what you do is morally acceptable. Now, coming back to the pregnant woman, I think you can see then a little bit, this is sort of a case of double effect. What makes it look like it's active and passive is that there are two actions that are open to the woman. One is a direct act, the other is an omission. She either directly starts chemotherapy, that's the active stuff, or she refuses, that's the omission. And I think it's because the two different acts, there are two different acts open to her, and one of them she does something and the other she withholds or fails to do something, we can be, I think, fooled into thinking, oh, this would be a case relevant to what Rachel's is arguing. No. No. This is more a case of double effect, because whether she starts the chemo or whether she doesn't start the chemo, you're going to have two effects from each of those actions. There's going to be an effect for the mother and an effect for the baby. And someone using the double effect line of argument would say, as long as the mother getting chemotherapy intends to save her own life rather than to take the life of the baby, it's morally permissible for her to have chemo. If she decides not to have chemo, as long as her intent is to save the baby's life and not to kill herself, to commit suicide, in effect, then what she does is morally acceptable. Now, what we said a day or two ago, or maybe both days, was, well, a case like that, whichever choice she makes, it's also morally acceptable because she's not free to save both of them, at least as we've set the scenario up. Double effect arguments, I think oftentimes the issue of freedom is involved in there, the case of giving the medication or not. I'm not free both to relieve pain and not take a life. And if I relieve the pain, I'll fail to not take a life. If I preserve life, I will fail to meet the requirement to relieve pain. So that's also sort of a freedom situation too. What the double effect argument adds on top of all of this is to say that, well, yes, you're not free to do both things, but the one that you hope happens had better be the good effect rather than the negative effect. Otherwise, if you do something that allows something evil to happen, even though something good happens, if your intent was to have the evil thing happen, then no, you shouldn't do it. Now, what I'm going to say next, I don't intend to confuse you, but it may be a little bit confusing as anyway. A double effect argument is not saying it's okay to do evil so that good may come. That's not what it's saying. It's saying it's okay to do an act which itself produces a good result and a bad result, and you're morally okay as long as your intent was to produce the good effect. You see, that's very different from saying, well, I will kill so-and-so because many good things will happen, such as I'll make a point to, I'm not a soldier, I'm a civilian, I will make a point to assassinate Hitler because by doing that, that'll be the end of the Nazi regime. Well, I think we would say that would be a goal that would be appropriate if you are a soldier. If you're not, I'm not sure that we're empowered with that kind of power, but that would be an example of doing evil so that good may come. That's not what really double effect arguments are trying to say. So even if you think that double effect arguments are sound and you'd like to use them in some situations of decision making, don't be trapped into thinking that you should start thinking about some evil thing that you could do and it'll be okay because it brings something good, and yeah, as long as you want the good thing, it's okay to commit the evil. No, no, no. No, not at all. Okay.
Just a question about that. If a patient's on like futilely end of life, he's on a ventilator, and he looks and sees that he's taking up lots of resources and money, and he says, I'm willing to sacrifice my life so that other people can get these resources and money that may have a chance. Is that doing evil that good may come, or is that an act of moral supererogation, a la Christ sacrificing himself on the cross?
Good question. Let me see if I can repeat it accurately enough and correct this if I don't say it correctly. Let's say somebody is at the end of life and their care is really involved and it's really expensive, and they're conscious enough of what's happening. They know it's a drain emotionally and a drain financially, and they know that there's limited resources, and they realize that if the technology that's being used to keep them alive, it's not going to save them, but being used to keep them alive, if that were withdrawn, a lot of those medical resources could be used to help other people who could be cured or greatly helped. And the person says, well, I think I'm going to do this because it would be sacrificial for me to do it, but of course it's okay to sacrifice. The question is, would that decision be morally acceptable first, to remove the technology? If so, would it then be morally obligatory to do this? Or would it actually be a work of supererogation? Great question. I think, first of all, there is no moral obligation to remove the technology so as to help other people get some of the resources. That goes back to the discussion that we had, I think, a couple of days ago about sacrificing. Yes, you could make a case that sacrificing is morally obligatory, but we said not all sacrifices are morally obligatory. The ones that remove all of our rights, all of our resources, endanger our life are not obligatory. So it's not morally obligatory. At least let me put it this way. If you hold a non-consequentialist theory of ethics, it surely is not morally obligatory. If you're a consequentialist, then you're going to consider risk-benefit, and you think, well, yeah, I will lose one life, but look at how many other lives can be saved. And so if my theory says do the greatest good for the greatest number, then I could come to the conclusion as that kind of consequentialist that I'm morally obligated to end my life so that other people can have these resources. But if you're a non-consequentialist, that shouldn't enter into your thinking. So you're not morally obligated. Are you morally permitted? Well, yes. And the reason I'm saying it that way is I think I'd want to know what the intention is. If the intention is that I'm really concerned about other people getting medical care, rather than here's a way I can die and end this and make it look like I'm a hero, no. I don't think under those circumstances it's morally permissible for you to do so. Not because the act is wrong, but because you'd be acting immorally with that kind of motivation. If I decide to do it, we said it's not my duty to do it. I am permitted to do it. And if I have the right motivation for it, and I go ahead and do it, yes, I think it is an act that goes above and beyond the call of duty and does so in a good way. I think it's heroic. Part of my reason for hesitating with all of this is there's some people who'd like to take this and they can lay such a guilt trip on the person who's the patient that somehow or other that patient comes to the point of convincing himself that it would really be noble for him to sacrifice for the sake of his family or whatever, and can rationalize, assuming that he's mentally able to do that kind of thing, that, you know, it's okay if I end my life by doing this because it will accomplish a lot of other positive things that are sort of heroic. Well, you know, if that's the motivation, then that's consequentialist motivation. Most likely, I can help other people out. I can wind up making myself look like a hero, and you know, all of those things would be really good. Well, let me talk about one more thing, and then let's take a break. The wedge argument. Now, sometimes this argument is referred to as the slippery slope argument. You perhaps are familiar with it in that form. And there is a form of the slippery slope or the wedge argument which is logically erroneous. It commits a reasoning mistake, but there is a way in which you can state this that doesn't commit such a problem. Here's the problematic way. If we allow people to pull the plug, it won't be long before inevitably they'll want us to give them a lethal injection, And if you allow those things, inevitably you're going to wind up with something like Hitler's death camps. Now, in other words, you say, well, how does Wedge get into it? Well, if you open the door, if you put a wedge in the door so it's slightly open to allow some killing, inevitably you'll get the worst. Well, that's a logically fallacious way to make this argument, because there's no inevitability on the one hand, and there's going to be a great difficulty in proving that by allowing people to remove technology in certain instances, you are causing all kinds of other things. Boy, those causal connections are pretty hard to prove, especially when they deal with a person's state of mind, and so you get into the psychology of decision making. That's going to be very hard. So you don't want to make that kind of statement, whether it relates to euthanasia or any other topic. There is a way to make this argument, however, and I think the person who is as good at doing this and has made it as well as it can be made is the ethicist. I think he still teaches at Harvard. His name is Arthur Dyck, D-Y-C-K. And he says the way to make this argument is to say that if you allow euthanasia in certain instances, then you have established a principle. And the principle is that there are some lives that are not worth living. And then there's no inevitability about this, but here's the next step in this. If you have established that there are some lives that are no longer worth living, where do you draw the line, and how do you know where to draw the line between lives that are not worth living and lives that are? See, in other words, if you've established that you can open the door to killing some undesirable lives, how are you in a non-arbitrary way going to be able to say, well, these instances of lives can be done away with because they're truly not worth living, but now everything else is worth living? And the point that Dyck is making is there isn't going to be any non-arbitrary way of drawing the line between lives which are worth living and lives which aren't worth living. And I do think that stated that way, the wedge argument is a significant argument. Now, it's not as though pro-euthanasia folk don't have an answer to something like that. They can say, well, we can tell you how you can draw the line. You draw the line by means of freedom of choice. Everyone has the freedom of choice to decide to end their life under the circumstances and conditions that they want. So if someone says, I choose to give back this life because I think it's not worth living, well, then that's acceptable. If someone says, I don't choose to end this life, then evidently in their estimation, this is a life worth living. So that's how you draw the line. Or you might have someone who would say that, well, lives that qualify as persons are worth living, and lives where the person is so diminished that they wouldn't qualify as persons are not worth living. That's how you draw the line. Well, okay, that's what the pro-euthanasia side would say. Do you see why it's important that we have an answer to the personhood and the freedom of choice? Because if we don't, some of those things are going to get invoked to answer something as powerful as the wedge argument.